Hello and welcome to the latest edition of WVU Medicine Tuesday Talks. I'm your host, Mary Ravazio Menard. Do you want to have children but are having trouble getting pregnant? What infertility treatment options are available to you and your partner? Today, we're talking about infertility and reproductive medicine with Dr. Ryan Heitmann, Medical Director of the WVU Medicine Center for Reproductive Medicine. Welcome, Dr. Heitmann, to Tuesday Talks.
Thank you, Mary. We're very happy to be here.
It's good to have you here. Now, we do encourage questions in the comments section here of our Facebook page about infertility or other reproductive medicine issues, and we'll try to answer them live for you. So feel free to ask your questions. Okay, let's start first with the WVU Center for Reproductive Medicine, WVU Medicine Center for Reproductive Medicine. What can you tell me about the CRM?
Well, the CRM has been around in its current location for about the last 20 years. And over that time, especially over the last year or two, we've really grown. And to now we have 3 REI providers and a staff that encompasses about a total of about 13 people. And we provide a wide range of infertility treatments, but also just other gynecological conditions and even just endocrine or reproductive endocrine conditions to patients in the state, but also in the region, the tri-state region.
Okay. So imagine you offer a lot of services, but I'm going to guess that infertility keeps you the busiest.
Absolutely, yes.
Okay. So how common is infertility?
It's a lot more common than people think. I don't think it's talked about a lot in the medical community during appointments, and definitely not talked a lot about even amongst family and friends. But 1 in 8 couples will struggle with getting pregnant or maintaining pregnancy.
That's a lot.
It is.
That's more than I thought it would be. So you help couples struggling to get pregnant or struggling to maintain a pregnancy?
Yes, we will deal all aspects of getting pregnant and maintaining a pregnancy through the first trimester.
Okay. So what are the most common infertility conditions?
They're wide-ranging, anywhere from ovulatory dysfunctions, which is probably the most common, probably followed very closely by male factor or sperm conditions, but can also involve issues with the uterus or the fallopian tubes. And there's a subset of patients that we don't find a very specific reason, for something we call unexplained infertility.
Okay. What are the most common reproductive conditions that you treat in women?
I would say disorders of ovulation and just unexplained, there's no factors or real good reason why they're having difficulties getting pregnant.
Okay. So so if you get a patient that has an ovulation disorder, how do you treat that? What are the options for ovulation disorders?
Sure. We start off looking at their general medical history and seeing if there's any organic causes for their dysfunction, and doing some lab tests and ultrasounds and trying to get down to the root cause of what's going on. And then we can offer even simple things like medications for egg development and ovulation. And sometimes it's just as simple as that.
So it could be simply just taking a medication to get you to ovulate in a predictable manner.
Exactly. Sometimes it's as simple as taking an oral pill for a few days every month and tracking to make sure the response is there and triggering the ovulation to occur.
Okay. What about if the issue is fibroid tumors?
Sure. Fibroids are a lot like real estate. Location is everything with them. And fibroids that are in the middle of the uterus or on the outside may not have as big of an impact on pregnancy as those that are on the inside of the uterus in the same space where we want the pregnancy to implant and grow. But sometimes those do require surgical intervention and removal to make a difference.
And what about endometriosis? Endometriosis, I can say that. Tell us what it is and how you treat that.
Sure. So endometriosis is the lining of the uterus, the glands and the stroma that's found outside the uterus and the pelvis. And it's very wide-ranging, from very mild to very, very severe. It's still one of the big enigmas that we have in our field, why some women get it and some women don't, and why there's such a wide span of pain and infertility associated with it, and its impact is somewhat still of a conundrum to us.
Are there any treatments for that?
There are good medical treatments to help with pain and discomfort from endometriosis. Unfortunately, those usually don't allow you to get pregnant at the same time. So the infertility treatments that we can offer do help overcome some of the endometriosis effects on infertility, but it's not perfect yet. And we know we still struggle with success rates in that area.
Still work in progress.
Still a very big work in progress.
Okay. What about recurrent pregnancy loss, miscarriages?
Yeah, that's one of the more harder things to deal with from just an
yeah.
emotional standpoint.
Oh, yeah.
The patients work so hard to get pregnant and then suffer those miscarriages, and sometimes repetitively. And there's a big workup that we do, and we try to get to the bottom of what's going on. And unfortunately, about 50% of the time, we don't come up with a definitive reason, but we do have some other empiric treatment options that we can offer and help women ultimately be successful.
Okay. And what about if a patient has a birth defect of their reproductive tract?
It depends on the birth defect and what the anomaly is. If it can be an impact on pregnancy or if it's going to affect their ability to get pregnant. Sometimes there's nothing that needs to be done or can be done. Sometimes there is surgical options that can be done to correct that and greatly improve pregnancy.
Okay. Well, we have our first question. We've been trying to get pregnant for some time. When should we seek care at the Center for Reproductive Medicine?
Sure. So infertility is defined as inability to get pregnant after 12 consecutive months of regular unprotected intercourse. But there are times that we will see patients sooner than 12 months, patients over the age of 36, a known ovulatory disorder, a known tubal disorder, somebody's had a tubal ligation or something, a known sperm issue are other reasons that we will see patients sooner than 12 months. We won't make them wait that whole 12 months. So.
Okay, so if it's been 12 months or if they're, older in age, so they would go to the Center for Reproductive Medicine for a workup,
Yes.
Correct? Okay. What's involved in that? What can I expect if I go there for a workup?
Sure. So usually the first appointment involves about a 30 to 60 minute sit down with one of the doctors, and we go through a very long medical history, reproductive history. It involves your partner too, so we get their history, and then where we go from there with ultrasounds or labs or different tests that may or may not be needed is kind of guided by that history.
Yeah, okay. Do you find also, and I don't know why this is, that some people, they feel shame. There's some shame attached to infertility, like it's their fault,
Mm-hmm. I do feel that, and that's maybe why people don't talk about it very much, is because there still is you have troubles getting pregnant. Well, I didn't. And so people do get ashamed, even in their own family. We hear it a lot that, my sisters never had a problem getting pregnant, but I do. And my mom never had a problem, but I do. And so there is that guilt associated with it unnecessarily.
And do you encourage people to know that, they are certainly not alone in this?
Absolutely, and I think that's the biggest message we try to get out as a society is 1 in 8 couples. It's frequent. It's just not talked about. So you probably have friends or family that struggle with this, and they're just not saying it, or you don't know about it.
Yeah. Now we were talking earlier about the different female problems, reproductive conditions. What are the most common reproductive conditions that you treat in men?
Issues that involve sperm in some manner, whether that's sperm production or some of the other characteristics of sperm, the motility or the morphology, how the sperm looks. Occasionally we'll see men who have, they don't produce any sperm, or they have a blockage in the tract and the sperm can't get out. Or maybe they've had a vasectomy in the past and purposely don't want kids, but now do.
Yeah, so how do you, let's start with abnormal sperm conditions. How do you treat that? What if you're not producing enough, or they're not fast enough, or how do you treat those conditions?
We work very closely with a reproductive urologist, Dr. Tom Jaffe. and he helps manage those patients and really looks into the fertility from a male aspect. So a lot of the same workup that we do in females, he will do in males to see if he can help increase sperm production or motility or what he can do to help positively impact couples' chances.
Okay, and what about for a patient, like you said, had a vasectomy and now, well, wants to change their options?
Yeah, they can also be evaluated to see if a vasectomy reversal is recommended or able to be done. If not, there are surgical techniques to go in and extract sperm that can be used in procedures like IVF.
Are most vasectomies able to be reversed, or what's the percentage of that likelihood?
It really depends on how long it's been. If it's been a long time, usually over 10 years or so, the chances are much lower.
Mm-hmm.
If it's been something more recent in the last few years, the chances are usually higher.
Okay, all right. What are the different treatment options for infertility in general?
Sure. I like to talk to patients. It really goes on a spectrum, and so it can be something as simple as we talked about before, just some oral medications, what the classic fertility pills that patients will read about on the internet or have some friends that took, but sometimes more higher-powered medications that involve injections of hormones might be needed. If there's issues with sperm, we can do intrauterine insemination, where we place the sperm inside the uterus to get it closer to the egg. But in some cases, we have to go into much more advanced treatments like in vitro fertilization.
And in vitro fertilization, now I'm dating myself here. So I'm not going to date myself. Explain what in vitro fertilization
Sure.
is.
In vitro fertilization is, what used to be called back, many years ago, the test tube babies. But
Yep.
It's where we stimulate the ovaries to make many eggs, and we go in and surgically harvest the eggs, get them out, and then we combine the eggs and the sperm in an IVF laboratory. So we fertilize them outside the body, and then transfer embryos back into the uterus to implant and cause pregnancy.
Okay. Now, this, you've been in this business for a while, but I mean, it has changed. Infertility treatments have changed a lot over the years. I mean, are you having a lot more successes than, in treating infertility with even in the last 5-10 years, let alone 20 or 30 years?
Yeah, absolutely. I think the technology changes, it seems like by the day. But
Wow.
Definitely each year there's always something new that's coming out that's helping to advance the field to make these treatments more and more successful. So patients aren't having to spend 2 or 3 or 4 years going through treatments and tens of thousands of dollars to get pregnant. We're a lot more successful all the times the first try.
That's got to be rewarding. More
It is very
success
rewarding.
stories.
Mm-hmm, absolutely.
That's great. What about fertility preservation services for men and women?
We do offer fertility preservation services for both men and women.
And what exactly are fertility preservation services?
So we will store eggs or sperm for patients who either want to delay childbearing, so elective fertility preservation, or those who unfortunately have a cancer diagnosis. Potentially, we may be able to preserve their fertility for the future, so they can get through their treatments and then come back later and have children.
And you can do this for both men and women.
Yes.
That's great. And I've seen on your website where you help with LGBTQ family building. What exactly is that? How do you do that?
Most commonly, we see female same-sex couples. When you have two males that are married, that gets a little bit more involved, and we haven't done as much of that. But a lot of the times it's just helping them through the process of using donor sperm and inseminations. But we offer reciprocal IVF, where we use an egg from one partner and the uterus from the other, and so they can have kind of a shared pregnancy experience. And there's all kinds of different combinations that we can go through with those.
A lot of options, huh?
A lot of options.
That's great. Now, I imagine, infertility could be a really stressful journey, an emotional journey. And it's my understanding you offer social service and grief support?
We do. Through the department, we have some great social workers that will help meet with patients and help them through these troubled times, whether it's the difficulties getting pregnant or with the recurrent miscarriages. That takes a toll on people.
I couldn't imagine. That's just heartbreaking. Yeah. So that's part of the Center for Reproductive Medicine, those services.
Those services are part of what we do and we offer, and we have access to the great resources.
Are there any other services you offer that maybe we wouldn't think of that would be available?
Yeah, we do offer nutrition and dietary services because there are many factors that go into being successful being pregnant, and weight and age are one of them. And so we do, age we can't change. We don't have that magic pill yet, but we can affect success with weight management and patients that need help with that. We have those services. And then with the advancements in our technology with genetic testing and genetic options, we have genetic counseling resources, so we can refer patients for those reasons too.
When you say genetic options, what kind of options are you talking about?
Well, we can do genetic testing on the patients, the females and their husbands, to see if they have any genetic disorders or carriers for specific conditions that maybe they're at risk for passing down to their children. But there's also genetic testing options on the embryos themselves that can be done.
Interesting. Okay. So for anybody that's watching and is interested in like what they hear here, how do they make an appointment with the WVU Medicine Center for Reproductive Medicine?
Sure. They can have their primary care provider place a referral to our center. They can go on the website and there's a place to request an appointment, or they can just call our office and self-refer.
So you don't have to have a referral if you want to self-refer?
Correct.
Okay. And we've got a website too.
Yeah.
WVUmedicine.org/CRM, as in Center for Reproductive Medicine.
Yes.
So got a couple options there. Okay, so before we leave, what's the most important thing you want our audience to know about fertility treatment at the WVU Center for Reproductive Medicine?
That we're here, that this center exists, and that we're here to help, and we have lots of different options for patients. So when they do feel like they've hit a wall and they're struggling, that may not be the case, that there may be more things that we can do to help them out. And that when we're moving through the process, it's not always a quick process. Sometimes it takes a few weeks or a few months, but everything that we do is we're trying to do things in the patient's best interest so that they can have the highest chance of success at the end. Because when they're successful, then we're successful.
Sure. And I meant to ask you earlier, does insurance cover most or some of these procedures, or does it depend, is it a case by case? Does it depend on the company?
It does depend on the insurance company. It depends even on the state that they live in. Some states are mandated coverage states, like Maryland. Unfortunately, West Virginia is not a mandated state. So then it really relies on what the insurance carrier is and the specific plan that the patient's on. We have great financial coordinators in our office that will look into that and can give very detailed explanations to patients on what is covered or what is not covered. But there still is a lot of unmet coverage needs in the field as a whole.
So you know what to expect at least.
Exactly.
Okay,
Yeah.
Great. Well, thank you so much for joining us today. You covered a lot of ground. I think we got a lot of information out there.
Hopefully patients find it useful.
Yeah. So contact the website or make that call. Thank you, Dr. Heitmann.
Thank you, Mary.
That brings us to the end of this edition of Tuesday Talks. If you're looking for more information about infertility and reproductive medicine, you can always visit wvumedicine.org/CRM. We'll see you on next Tuesday Talks on January 25th. We will talk about thyroid eye disease. I'm Mary Ravazio Menard, and on behalf of Dr. Heitmann and everyone at WVU Medicine, thanks for joining us and have a great afternoon.